Let's go over the solutions. How do we fix this? Well, as long as the injury isn't more than like a grade 2 or grade 3 tear where that muscle is torn too much, that's usually something that's going to need to be referred out to like an orthopedic specialist. But as long as it's a grade 2 or it's inflammation, irritation, swelling at that tendon and at the muscle, then we can address it at Rothrock Chiropractic and Rehabilitation with a three-prong approach. We could do the rehab first approach, and then in office, we focus on muscle therapies and chiropractic manipulations. So, with the rehab first approach, we're first going to start with McKenzie Method assessment. Now, usually with our shoulder injuries, rotator cuff included, if this is going to be classified as having a directional preference, it's typically going to be one of three movements that encompass about 92% of our cases. Usually, if it's the rotator cuff, the exercise that's going to typically do best by patients is the hand behind back internal rotation exercise that really kind of loads up that supraspinatus and the other rotator cuff muscles to get that rehab process going and start to refresh and restore that muscle. However, it's not uncommon to see extension or external rotation exercises be the directional preference as well. Whatever it is, we let the assessment guide, and then we just build the treatment plan and the home exercise plan according to what patients' bodies are telling us. After we're able to solidify that pain and stabilize things down, in time we go into strengthening phase. That's usually a handful of weeks in once pain is really improved and mobility and there's obvious stability in that rotator cuff syndrome. So things with the resistance bands like repeated external rotations, internal rotations, doing things with like the TheraBands, do like wall crawls, monster crawls, and then even just wall exercises like working on wall angels to really get some strength and stability back into the shoulder complexes, in addition to focusing on some rehab and corrective things at the neck and at the upper back.